Watch me with my inauguration, so I'm very proud of that. So I'm in charge of all the internists in the country.
Wow. Awesome.
That title as well. And I'm the first one of us ever.
Black History Moment, yay.
And all my sisters came down to support me, and that made me very proud. True heart, thank you. In Baltimore, Maryland. So today is a very important topic, HIV and AIDS, not just among us, but in the elderly. And many of you may not realize, but 50 and over is the elderly in the HIV arena. Since I've been doing treating patients and training in infectious diseases, back in the late 80s, early 1990s, many of our patients didn't live beyond a year, maybe 2 years, 30 or more medications they were on at the time, and we didn't have the best of therapy. Early on, HIV and AIDS was only seen in men who have sex with men, but today it's seen largely in the heterosexual population. I treat people as young as 15 and as old as 78 currently today. So even though it's not the death sentence that it was 20, 30 years, we're just coming up on World AIDS Day just last Monday. Our practice, Garden State Infectious Diseases, puts on a symposium every first or second Wednesday of the month. It's going to be at the Crown Plaza Hotel in Cherry Hill. But to make the awareness, and that there are all kinds of case managers who support HIV and AIDS, physicians, nurses assistants, everyone who's involved in the community. But I share this, and I'd like to talk out in the community only because many people think that this is a disease that has gone away, that they don't have to worry. Right now, I have a 43-year-old gentleman who's in one of my hospital systems who is fighting for his life because he has an undiagnosed pneumonia. And this is the history I get before we put him on a breathing machine. When he came in, he was very hypoxic, meaning he couldn't breathe. So to walk from here to the door, he's out of breath. For me, because he's a diabetic, everyone says, oh, is it just community-acquired pneumonia? I was like, I think it's more than community-acquired pneumonia. I asked him a bunch of questions, says he's married, lives in the Poconos, but he's in Stratford, New Jersey. So I said, okay. But he has a business here. I'm like, okay. A week later, he's not doing well on the breathing machine. We can't take him off the breathing machine. And even though when we talk about immunocompromised hosts, is your blood counts, are they normal, are they low? And typically they tend to be low. But in an acute infectious process, whether you have a pneumonia or whether you have anything, those numbers can go up. But his wife comes to the hospital. But there's someone who's always calling to see how he's doing. And today, under HIPAA violations, you cannot disclose any information, but he comes to the bedside, says that he's a cousin. He wants to find out what's going on. The nurses, the doctors do not communicate with him, so he wants to leave some information. He wants to talk to me. I'm not talking. So we talk to the wife. She has no idea who this person is. So when I go to the room, who is, again, middle-aged man who's struggling to breathe on a breathing machine, even though he's somewhat sedated on the breathing machine, meaning we're trying to keep him comfortable so he doesn't fight the machine that's helping him to breathe. I asked him, quite frankly, and the nurse is like, well, you're not going to get a good answer. I said, I can get what I need to get started because this is too long for him not responding to therapy. So I asked him, had he ever been tested for HIV? He can shake with a tube down his throat. So I said to him, it's not just your diabetes or regular pneumonia that's causing you to behave this way. Do you mind if I do? I didn't say, do you mind? I said, I would like to do an HIV test on you. He says, okay. He didn't say okay, he just shook his head because he has a tube down his throat. But I say this to say is that it's not just because he has diabetes that he has pneumonia. It's not just because he walked in my hospital for the third time and could not breathe. We didn't keep him the first time, nor the second time because he's middle-aged. We give him antibiotics, he's to respond, but he's back a third time. This time he's a lot sicker. It's not because he said he was in a hot tub while he was down here. And when we questioned the wife, she says, we don't have So she's confused. He is worried. So the rest of the story I will have, but sometimes I cannot wait until tests come back before I have to be active. Plus, the second most deadly bacterial pneumonia, this is pneumonia season. We talk about flu, getting your flu shot. People in general do not die from influenza. They die from complications of influenza, which is typically a bacterial infection called pneumococcus. Just know this. You vaccinated your children when they were very young against pneumococcus. We give a vaccine to the very young and the very old being older than the age of 65. But anyone that comes into a hospital system or comes to see someone like me with a bacterial pneumonia secondary to streptococcal pneumoniae is HIV until proven otherwise. This gentleman who's on a breathing machine not only grew up strep pneumonia in his urine, but it's also in his bloodstream. That is what raised my high index of suspicion that he may be HIV positive. And I will know in about another 10 minutes because where's Tanya? They're gonna tiger text me. No. So bacterial pneumonias can kill, and in an infectious disease, somebody's immune system is not strong. Now what happens, I'm gonna get to the slides in a minute. I just have to talk first. Because I want you to understand what HIV does. The reason why you have two parts of your immune system, a B cell response and a T cell response. The bursa fabricae, which is beneath your thymus, are the fighting cells your body makes at the time you're born. And you have those. They help you fight off viruses and bacterial infections. Then there's another part called your T cells, and this is the virus. This is what the HIV virus tends to destroy, is your T cells. They help you fight off viral and bacterial infections. At the time someone comes in contact with a virus called HIV virus, you hear about RNA, DNA in the media and the news. DNA just means it needs a partner to make more virus. RNA viruses, they can do it all by itself. HIV is one of those viruses that does it all by itself. From the time someone is exposed, by the way, if someone were HIV positive and they were to bleed all over this table and I had to cut and put my hand in it, I'm not going to get HIV because it doesn't survive in air. HIV virus is a virus that's transmitted, we call closed systems. The only way you're going to get it is through sexual contact or through intravenous drug use. That's the only way you're going to get it. Sexual transmission or intravenous drug use, or if you had blood products, the hemophiliacs. And that was prior to 1989 because all of our blood has been screened since then. If you were a hemophiliac and you received blood products prior to that time. But unfortunately, many of our hemophiliacs from that time are no longer with us because of the aggressiveness of the virus. That's the only two ways. The reason why I define it as a virus that can actually replicate by itself, because 10 million copies of virus, 10 million, replicate in a 24-hour period. As that clock goes around, 24 hours, greater than 10 million viral particles are produced from one viral particle. So when I talked about what cells fight, the bursa fabricae, you have B cells and T cells, the HIV virus itself, that single-stranded RNA virus, job is to destroy your T cells. And it does this by integrating itself into your helper T cells. And this is why we know that it takes 7.5 to 10 years to progress to full-blown AIDS, which is called acquired immunodeficiency syndrome, AIDS. Now, all people who have AIDS are not HIV positive. There is just a small segment of the population who have AIDS. They perform like and act like someone with HIV, but it's not that virus. It's usually another immunologic disease dysfunction that's causing them. But HIV is the one that we're dealing with today, and it's destroying our community. It's no longer just gay and bisexual males. Most of the women I treat, doctors, lawyers, professional women, nurses, school teachers, government workers, have acquired their virus through heterosexual contact. Many of them are not promiscuous, despite what statistics earlier said. It could be one sexual contact, because it only takes one viral particle in order to start this, no matter what their sexual practices are. Okay? So you may not hear it in your circle being discussed, because I can guarantee you over 75% of the women I take care of don't discuss this with anyone. Many of their own children do not even know that they're infected. And I deal with couples or men who are married where their wives don't know, or the vice versa, women who are married where their husbands don't know. But I have a way of asking them to communicate to them for safety, and many times that happens in my office. And their marriages survive. Love is greater than HIV and AIDS. But the fact that someone else makes a decision to expose you to a virus without your knowing is not right. And we as a community have to embrace our brothers and sisters who are infected with this virus so that they can feel comfortable in taking the precautions and getting the care that they need. Okay? I have patients, husband and wives, who have borne several children. None of them are infected because we take precautions during the time the woman is carrying the child. 25 years ago, that didn't happen. New Jersey had one of the highest rates of mother-to-child transmission of this virus next to New York City. The classical 076 study to decrease the rate of transmission from mother-to-child transmission was right here. My senior partner, Dr. David Condalucci, was a part of that, and Cooper Hospital System as well, Dr. Bennett. Okay? So, we were able to decrease new infections to children. But if a mother who is pregnant does not get tested, even though it is mandated, and I speak to enough gynecologists, obstetricians, to screen every woman in her first and third trimester to make sure she's not HIV positive. Do I get women who are negative their first and are positive in their third? Yes, I have. That's a very frightening situation, because I'm trying to get everyone under control and get that virus under control so she does not transmit. Do I get women who were tested their first trimester, their third trimester, and then become positive 8 weeks later? Yes. True case in point, young woman, 23 years old. Her family doctor called me because she had what was called a persistent fever. You heard of mononucleosis? When you're in school, the kissing disease, it's a virus, but you clear. Her lymph nodes, these are nodes. You have nodes everywhere. And in my lectures I give to young people, what's love got to do with it? I let them feel what lymph nodes feel like. I have them to palpate themselves. They're in your arms, anteriorly and posterior cervically. They're in your inguinal area when they're inflamed. So when you get a virus, those helper cells that I was talking about go into overdrive to try to recognize what that virus or bacteria is. Once it recognizes something's there, it starts to fight. But for this young lady, she was fighting all the time. She couldn't eat. She had fevers greater than 101.5, just didn't feel right. And she worked in healthcare. And she kept saying, something's wrong, I'm tired all the time. Everyone kept saying, oh, you just had a baby. She said, the baby's fine, but I am sick. And her doctor called me after she tested her for everything. I said, send her to me. She did. I said, this is not just a regular fever of unknown origin. It was HIV knocking on her door. She was in the process of seroconverting when she was having those high fevers. So many of the testing centers, like what Tanya does, she's our outreach coordinator for HIV and AIDS. She does testings and screening. Everybody can get screened every day of our week in the office. Just call Tanya. Okay, it doesn't go through your insurance company or anything like that. We offer testing 5 days a week. But what was happening was that her body was fighting this virus. So then, once I diagnosed her, we had to work backwards. We had to retest the baby. We're calling the pediatrician, retest the baby now, do PCR testing, and I'll explain what that is in a minute. Baby was negative. Where's your husband? She says, my fiance. They weren't married yet. They are now. He comes to me. We test him. He's positive. Now, chronologically, I can tell who's been infected longer and how long they've been infected. He was a young man who had full-blown AIDS, but he looked like any one of us in this room today. He did not know he was HIV positive. And that is their risk. That was her risk. They're now married. They're raising a baby. They're pregnant with a second child. They're family now. They were a family before. But when you get into questioning people, how they may have come in contact with the virus, back in the late 80s, early 1990s, that was very important to me because we were trying to get a hold of how the virus, who has the virus. Today, it's important in terms of educating people to not get infected. But to delve in this avenue with them would have destroyed that family. Because many men who have sex with men do not consider themselves gay or bisexual. Just like young women who have experiences with women don't consider themselves lesbians. Some are married, some have friends. This is a whole new lingo that I've had to learn and try to adapt to at 51 years of age. It was a bit hard to swallow for me as an infectious disease specialist. But I had to get used to their terminology and what happens in order to help my patients. I can't say, I don't believe in this, I don't believe in this, don't come near me. I couldn't do that. I had to break my barriers down and say, this is what we're dealing with today, despite the teachings that I think and personally feel should have been going on in the home. Okay, so that's not the issue. The issue is HIV. Maybe now that they know about HIV, maybe as they raise their own children or their own relationships, they can then reinforce, but that was not my place any longer. So I say that to say because we're missing a lot of people. Every 8 minutes, someone in this country is infected with HIV and AIDS. The Northeast Corridor, where we live, New York, New Jersey, Washington, D.C., the South, are loaded. In Washington, D.C., where I am from, 1 out of 7 African-American males are infected with the virus. 1 out of 10 women are infected with the virus. This is bigger than what you think. So this is why I say to individuals, I don't care if you're married, gay, straight, or bisexual. Everyone needs to know their HIV status. And what became very real to me is when I was first finishing my fellowship, we were in Atlantic City at a meeting. It was a group of female infectious disease doctors across the country. Imagine, this is in 1998. I'm sitting in a room and we're talking about diseases and epidemiology that affects people. HIV and AIDS was the top of our discussion. But when we came in, we had a little blinded survey that every physician had to fill out as to what disease was most critical. Would you get an HIV test? Was one of the questions. Would you test your significant other or spouse for HIV? Would you, or do you, they were very personal, do you sleep with your significant other without a condom? I was blown away. At that time, I was not married, but I was blown away at the discussion and the answers to some of these questions. Because 79% of those female infectious disease doctors would never sleep with their husbands without a condom. And they gave various reasons. One from travel, we're here, we're married, we've grown apart, we do our own thing, till I'm very devoted to my husband, I don't know if he's very devoted to me, or I step out on my husband, he doesn't know I step out. So it was all kind of reasons as to why. But I was really blown away by that. And then they said, when it came to the discussion, they said, ask your patients, how many of them who have acquired the virus slept with their husbands or their wives without a condom? And ask those who have acquired the virus, who did they think they were sleeping with? That's a good question. When we talk about sexually transmitted diseases, I don't, if it's chlamydia, which is very easy to diagnose, gonorrhea, now we have pharyngeal gonorrhea, we have rectal gonorrhea, syphilis, human papillomavirus, bacterial vaginosis, which is common for women. Any of the above deserves an HIV test. But realize that HIV can be the only sexually transmitted disease that people can acquire, and that may be their only risk factor for acquiring the virus. So with that little background, I'm going to go on, but we're going to ask questions, we're going to have discussion, because this is important to our community, because this room should be packed. It should be packed, we should be angry, we should try to fight and do what we have to do, because you don't have to get this virus. And when I talk about the prison systems, that's a whole nother discussion. It's offered for everyone, men and women who are incarcerated. Our brothers and sisters come out of incarceration, but many of them cannot share what has taken place behind doors because their outside world was something different for them. So we have to be able to feel comfortable to have that discussion with them and so forth. So I'm going to skip ahead. Tanya, you got me going here. I'm not going to talk about hepatitis. I'm just going to go about HIV. Oh, let me just say one thing about hepatitis C and hepatitis B. Your children, anyone is born, we have some baby boomers here. All of us pretty much baby boomers. Pretty much. You're a little younger than that. Okay. But the baby boomer, that's if you want 1954 to 1965, baby boomers. Many of you were not vaccinated against hepatitis B virus. Hepatitis B virus is another virus that can be sexually transmitted. Your kids, or your kids are going to college, they have to have that as a requirement. So hepatitis B virus, hepatitis B there's no cure for. I have to put them on medications for life. Another sexually transmitted disease, you hear the CDC pushing, everyone needs to be protected against hepatitis C. We know that hepatitis C is not just from intravenous drug use, intranasal cocaine use, it is and can be sexually transmitted as well. So this is why we're asking patients and we're pushing primary care or providers to test their patients for hepatitis C virus. If your physician or your primary care provider hasn't offered you a hepatitis C virus, ask them, I want to be tested for hepatitis C. Why? Because hepatitis, just like hepatitis B and A, can affect the liver, can cause cirrhosis of the liver. But the beauty of hepatitis C today, we have a cure. From treating people, the treatment is less than 12 weeks, 8 weeks in some individuals. We didn't have this prior to 2011. Today, we can cure hepatitis C virus. Globally, it's one of the most predominant viruses we have to deal with, but there's a cure today. HIV, there is no cure with. So I just wanted to say that before I get to the HIV. Okay, Tanya, I'm trying to go back. Okay. HIV in the elderly, some may be offended by the title, but it's 50 and over. So Americans age 50 and over have one of the same HIV risk factors as young Americans. Persons age 55 and older account for 19% of the 217,000 of the estimated 1.1 million people living with HIV infection. This is data from 2010. We have since changed that to 50 and over. Older Americans are more likely than younger Americans to be diagnosed with HIV infection later in the course of the disease. What do we mean by that? When that virus integrates itself into that CD4 cells, I told you it takes 7.5 to 10 years to progress to full-blown AIDS, but it takes about 2 weeks. We can detect the virus in your bloodstream as early as 2 weeks before you make a memory cell. That's all an antibody is. When you get an antibody test, a blood test for HIV, that's a memory cell that your body's been exposed to that single-stranded antigen I talked about that can make 10 million copies of virus within a 24-hour period. This is why people who have in rape cases or unwanted sex cases, people who have been sexually assaulted, we try to get them to someone like myself in order to screen and test them, because if it is positive, then I have to put them on meds within 7 days now in order to keep their bodies from seroconverting. Okay? New HIV, 50 and older, of the estimated 47,000 new infections in 2010, 5% were among Americans 55 and older. Of these older Americans, 36% of new infections were white males, 4%. 110 were white women, 24% of the new infections were black men, and 15% were black women. 12% of new infections were Hispanic and Latino men, and 4% were Hispanic and Latino women. You always have to remember geographically where you are. In our practice, we have about 1,800 patients. Many of them, the majority of them, are over the age of 40 who are positive. okay? The Cooper Early Interventional Program takes care of our pediatric population. But when we get PEDS cases, we start looking at siblings. And when we get parents, we start, and those who have never tested, then we start looking at their children as well. So, this is just a percentage of what we see as terms of 2011 estimated diagnosis of HIV infection by age here in the United States. Look at this of the cases. This is the 50 and over I'm talking about. But the majority of the cases between this, when I say greater than 15, particularly in the 20 to 24 age group, many of them present with pneumonia, and it's that bacterial pneumonia I was talking about, like the young man was fighting for his life on the ventilator right now with strep pneumonia. Pneumococcus is the second most deadly bacterial infection we see in our patients. The other one is called PCP, Pneumocystis jirovecii carinii pneumonia. It's a fungus. It's a fungus that actually takes the breath away of our individuals when they try to walk. That's PCP. That's usually definitely a diagnosis of full-blown AIDS. They've had the virus for a long, long time, but their body can no longer fight. And if we don't treat PCP, then they can die. So, of the estimated diagnosis of HIV infections among adults 50 and older, gender transmission, in terms of women, the majority, about 82% of the women who acquire this virus is through heterosexual contact. Okay? Compared to our males, about 23% heterosexual contact, 60% of men who have sex with males, and 14% of intravenous drug users. Although heroin is on the rise in our community, down the street from our hospital, they can get it for $5 to $7 a bag, and most of my heroin, and I'm sad to say, it's not just the young people who are back on heroin today. We have a lot of people who are adults, people you think know better. I got a lot of functioning heroin addicts who go to work every day, 5 to 7 bags. They not only come in by themselves, but they come in with their children.
Wow.
There's something wrong here with their children. The OxyContin scare, the Percocet scare on the streets, the pharmacies, primary care physicians are trying to minimize what they give, so they can't get that any longer. As one of my patients who's going into rehab today, he says, Dr. Lightfoot, that was on Wednesday when they procured a bed for him up in Newark, New Jersey, at Princeton House. Today, he had to leave. He couldn't sit still in my office. I have to go. I tried to hold him there a little bit longer. I said, I need blood work. He said, no, can I come back tomorrow? I knew where he was going. His girlfriend was with him. She says, there's nothing we can do. He says, you don't understand what it's like for me to go through. I don't want to be in pain. I don't want to have to crave. He went and got his fix. Hopefully he's at Princeton House today. But that's how he acquired it. So even though you see that 14% of intravenous drug uses, the Clean Needle Works programs, Camden has one. A lot of states have them where they don't have to share needles, because even in a syringe, the virus can stay active. And that way, it only takes 1 ml of blood in order to affect transmission of the virus. So in 2011, patients, or people aged 50 and 54, represented 47% of the estimated 8,440 HIV diagnoses among people aged 50 and over here in the United States. The estimated annual numbers and rates of HIV diagnosis in this age group remain relatively stable. In our office, some weeks we can see anywhere between 5 to 7 new cases of newly diagnosed people, and we're one infectious disease office. So you're in a hot spot, if you don't realize. New Jersey, Pennsylvania, Boston, Connecticut, you're in a hot zone for the virus. And not just San Francisco. You know, San Francisco has quieted down. I mean, you don't hear about San Francisco anymore. You hear about all the other states, and states in which they thought they never had a case, that they're having cases. So in 2010, the estimated rate of those diagnosed older blacks was 47%, which was nearly 11 times the estimated rate for whites and 3 times that of Hispanic and Latinos, and 46 states for confidential name-based reporting. Not all 50 states report who's HIV positive. So our blacks are 11 times what we see of our white and Hispanic counterparts. From 2007 to 2010, the estimated annual number of diagnoses of HIV infection was attributed to male-to-male sexual contact increased among men aged 50 and over in 46 states with confidential name-based HIV reporting. Now, I'm going to say this. Some of my older patients whose spouses have gone on are entering a whole new arena of dating. It is not the dating that it was 30 years ago for them. I give these lectures particularly to everybody really, because people who are entering the dating world today don't think about asking these questions. Have you had a sexually transmitted disease? Have you ever been HIV tested? And people don't always tell the truth. We have patients on medications who are supposed to use condoms and protective barriers who will, and we can tell that they're not using condoms because they have another sexually transmitted disease, despite all the education and the free condoms that are given out. So if they've passed on or acquired one STD from somewhere else, they're probably passing on HIV to someone else. So the dating game has changed. People's life perspectives have changed. I have men who have sex with men who have 5 grown children and 2 ex-wives. Okay? So this is why this lecture is important to all people. Again, it's not whether I agree with it or you agree with it. We have a community, and a community that is sick, that is spreading virus. I learn from some of my patients who have to talk to me. They tell me about the parties that go on in Philadelphia. Did you know, like the Marriott Hotel lends out, they don't lend it, they pay a lot of money to have closed private parties on the top floors. They're trying to stop this party promoter. He goes up and down the East Coast. He's been in Atlanta. I won't call his name. I know very well who he is, but charges are being brought against him. Because when I see young boys and older men going to a specific hotel for a party with their own security, this is really happening. I didn't want to believe it. But when I have too many patients that I really know well, who are in higher positions, and it's all kind of people of various social economic backgrounds. I don't care what degree you have, how many letters you have behind your name. When it comes to sex, our people are out of control in what they do and what they share. And the responsibility. Some people who are positive will say to me, what they're dealing with me, they know what they're dealing with. That's not always true. You don't have the right to make the decision for someone else. You need to be upfront and disclose. But what I'm saying to my elderly people who are going out, or to young people in general, everyone does not disclose. And when they tell you, no, I'm not infected, go with them together and get a test together at the same time. Right, Tanya? Yeah. We offer that. Lord knows, I've been married, I can't even remember how many years now. But when my husband met me, all of his buddies used to say, you married an infectious disease doctor. I don't even have to begin to say what I put him through. And I wanted to know anybody and everybody and where they live. I want to know their people's people. Our people today don't even know the last name of someone that they've dealt with. When they come in for sexual assault cases, or they say someone blinded me with a drink, or they just say, I think I've been, well, who? Why, I don't know. Well, where were you? Well, we were all at a party. You know, I mean, this is what I get. Don't you, Tanya, in the interview? They don't know. They don't know. And it's not just the young people. It's our people. So in 2011, people 50 and older accounted for 24% of the estimated 32,000 cases diagnosed in the United States. This is old data. But among the estimated 19,434 deaths among people living with diagnosis of HIV infection in the United States were among people 50 and older. In 2010, HIV was the 10th leading cause of death among men and women aged 50 and 54. We make new diagnoses in the 50 and 54 category. Any woman that has an abnormal pap smear should have an HIV test. We screen our women twice a year initially, and then once a year, because the incidence of cervical cancer is much higher in HIV-infected women. When I talked about your soror, Dr. Robin Wilson-Smith, I asked how many of you knew her. She's GYN oncology. Robin gets all of my work from Garden State. All of it, where she can't even get them on the books in a timely manner. So the cervical dysplasia is usually due to human papillomavirus, HPV. Men now are acquiring human papillomavirus. As quiet as it was kept, Michael Douglas just didn't have throat cancer. He had human papillomavirus. Okay? So our head and neck surgeons are diagnosing more people with HPV of the oral mucosa. Your dentist, and if they're not examining your oral mucosa and they're just cleaning your teeth, they are not doing their job, because what may look like a warty growth, or what they call just a papilloma, it's a papule, don't worry about it, may be HPV. So late diagnosis, older Americans are more likely than young Americans to be diagnosed with infection in the course of their disease, meaning late start to treatment and possibly more damage to their immune system. This can lead to poor prognosis and shorter HIV to AIDS intervals. So it basically, and particularly the more comorbidities, do they have high blood pressure, do they have diabetes, are they on steroids for lung disease, are they on immunosuppressive agents because they have underlying rheumatologic disorders, that may affect their progression to full-blown AIDS a lot quicker. And this is one reason why when this happens, sometimes when I start them on medication, they tend to be more compliant than my younger population, because they understand they have to take this in order to survive. But there's also that stigma of, I have the virus, I'm letting down my children. What am I going to do with my grandchildren? One lady would not go around her grandchildren for 9 years because she was afraid just by touching them, she was going to give them something. Okay? Imagine a woman, I'm giving you two true stories, 52-year-old female, had a dermatologic, I didn't even show you the clinical slides of HIV and AIDS because there's certain skin rashes that we look for. She saw every dermatologist, including one of my colleagues at the University of Pennsylvania. And when he called me, he was like, Judy, he says, I'm sorry. He says, I just didn't think I would see this in her. But it was a Dr. Camille Simple, who's not too far from here, an OBGYN. The woman had the worst case. Have you heard of thrush? Babies have thrush. Thrush means something at this stage, unless you have an oral inhaler because you don't breathe right to control your breathing. She had thrush everywhere. She had the worst case of vaginal candidiasis, and she says, I don't know what to do. I've never seen, vaginal candidiasis. I've given her all these concoctions. The patient said, I have these skin lesions, and she came in with a big shopping bag worth, of creams. What she had was an HIV dermatitis, and nobody knew it. Dr. Simple tested her. She came to me. She had no idea. No idea whatsoever. She was the one that would not go around again. She's since gone though, but just the earlier the diagnosis, the more we get it out, people don't have to feel like they can't come out and get the help that they need. Because she delayed her treatment for a long time, she developed renal disease. Dialysis? Take anybody to dialysis? Well, there's a component of HIV nephropathy. HIV affects every organ system, your kidneys. It causes confusion in your brain when you don't get treatment early on. Toxoplasmosis for the women who've had children. When you had your children, they asked you if you had cats. If you had cats, you couldn't empty the litter box because of toxoplasm. They told you to cook your meat very well because steak tartare or uncooked meats is a parasite called toxoplasm that crosses the placenta barrier. Well, toxo can cause lesions in the brain and make you very confused with HIV. So HIV not only affects the brain, can cause meningitis, it affects the lung, it talks about the pneumonias, I talked about the PCP, the pneumocystis jirovecii pneumonia, can affect your liver, but it also can have skin manifestations, and that's what this woman had. And because she was so embarrassed and so ashamed, she would not see her grandkids. But she let it go. It affected kidneys. She had to end up on dialysis. She didn't like dialysis. She wasn't diabetic. But in our young patients, many of them present in renal failure, where the kidneys aren't working. It's not because they've been cutting grass in 105-degree temperature and they haven't had any fluid. They're not really dehydrated. You hear about stroke, heat strokes. It can affect the kidneys. But any young person who comes in with kidney failure, for me, is HIV until proven otherwise, because particularly in African Americans, HIV nephropathy. Okay? So, today, it's meant to be a wake-up call, informational. There's a lot we can do today, but if you can't get people past the stigma of being tested, then we don't go anywhere as a community. That's the real message. So if we start by telling our friends, our girlfriends, our children, our brothers, our sisters to get a test. The test is how long, Tanya?
20 minutes.
20 minutes. You know, it's not even a blood stick. Okay? We can do something. We can save our community. These meds are lifelong because there's no cure for HIV. They're very costly, about $2,300 a month. That's for one prescription, for one medication. Okay? So insurance companies, we have a program in New Jersey that pays for the meds, but all 50 states aren't as willing to help those infected. If you're in Texas, they'll pay for one antiretroviral medicine to cover the virus, and you pay for the other two. Most people can't afford it. So what happens? They die. Or they have to wait on the list until someone dies before they can get on the list to get their medications covered. Okay? But it's a lot we can do. We just test. One reason healthcare providers do not always test older people for HIV. What about grandma who's losing weight? Everybody thinks it's cancer. True case in point. I had an elderly white woman. She was 68 years old. She was at Our Lady of Lourdes. They thought she had a cancer that they couldn't find. She ends up in my hospital system because she's short of breath and pneumonia. They said, oh no, it's just she has malignancy. I said, no, did anybody test her for HIV? Her children were very offended. All 13 were at the bedside and wanted to throw me out of the room. I said, where's your husband? She said, he died. I said, when? In the late 70s. What did he die from? Remember the old Virtua on Evesham since Tornado? He was in a hospital. He had pneumonia. They didn't know what kind of pneumonia it was. He died. Think about 1979. Where were you in 1979? I was still in high school. But just think about 1979 is when he died. HIV has been around since the 40s. We just didn't know what it was. Okay? So he died, although I cannot prove it. But once we tested her, that was why Grandma was losing weight. And because she had never remarried, she just got sick over time. She was just relieved. She said, I can put my head down because I know what I have now. She lasted a little bit longer than that, like 7 years. We treated her. But the meds were very hard for her to tolerate at that time. So, again, prevention. And all providers should be offering testing. And I tell patients, put your health in your own hands. That's the message of healthcare today. Prevention, whether it's diabetes, high blood pressure, HIV and AIDS, you are responsible for your health care. If they're not testing you, ask your provider, why not? Why not me? We don't want it to be you, but you gotta know. Many older Americans are sexually active. Well, this surprised me when I got called to a nursing home. It's not too far from here, though. I got called, actually a couple of them are asking me to come in because you know, the little man who they thought was demented is not that demented. You know, and Miss Sadie is tired of him because she's been with him for all, and she's tired. She don't mind him wandering in the middle of the night. She's glad it's them and not her. These are true scenarios, you know. And they have to escort him back to the room, you know. But he's been, you know, and then women get to fight. You know, it's less of them as we get older, and they get really possessive. You ever see the nursing home crowd? What are you talking to her for? You were supposed to have coffee with me. Yeah, these are real scenarios, okay? And for our women who have been married, husbands gone for whatever reason, who are stepping back out in the community, you have to have this honest discussion with whomever you're dealing with. Let's go get tested together. So, we want to make sure that many widows and divorced people are dating again. They may be less knowledgeable about HIV than younger people and less likely to protect themselves. Many of them have never used a condom, never had to. You do today. Women no longer worried about getting pregnant may be less likely to use a condom and to practice safer sex. Age-related thinning and dryness of vaginal tissue may raise older women's risk of transmission of the HIV virus. It's a closed system. The lining is thin. Women have some protective barriers to prevent them from getting this virus, but don't count on that 100% of the time. And as we get older, we lose that. The availability of erectile dysfunction. Medications may facilitate sex for older men who otherwise would not have been capable of vaginal or anal intercourse. Listen, before y'all came, I had mentioned my husband had retired 3 years ago. He worked for a big pharmaceutical company, was regional director, all of that. He decided after 3 years he wants to go back to work. I'm like, I got enough for you to do. He just missed the interaction, so he's going back part-time. A lot of companies have been after him. He said, do you know this company called Alluvium? I couldn't remember why I know Alluvium. And I said to him, I know that name for some reason. They supply testosterone replacement therapy, and a lot of my male patients have depletion of testosterone because of the virus. They have a new drug to compete with Viagra. I tell them, first of all, keep that away from me. Don't think you're going to try this out so you can tell the physician's offices you frequent. But to a man who's diabetic, who may not have the drive that he had when he was in his 20s or his 30s, and they're a lot cheaper than Viagra, it's going to jump for something like this. The nursing home population, which is real, or your parents, if they're still around, and mom's gone on, okay, may want to have a date, a little hand-holding. Hopefully it's just hand-holding, but it's often not, okay? They have, and they're not going to discuss that with us. They're like, who are you? Okay? So we have to talk to our parents as well as our elder community about risk factors and what they're using. So the stigma is a particular concern among older Americans because they already face isolation due to their illness or loss of family and friends. Many of those of my patients who are elderly said, why am I still here? Some of them just want to stop their meds, not live any longer. They're taking a pill for life. There's no one else around. All of their friends are gone. I had one of the award-winning journalists, I will not call his name, but he is my patient. He sees me for other things, but his GI doctor sent him back to me to test him for something else. He said, you know, Dr. Lightfoot, when I traveled the globe, and I've been to many, many places, and yes, I always knew I was a gay, very intelligent black male, and I could have had any woman I wanted, but my preference was just men. He says, I'm just fighting to survive. All of my friends and my buddies are gone. He says, and I'm 73, and I hope to make it to 79, then 89, and so forth. He says, I just choose not to engage at all because I know that people are not upfront about what they have. And he said, the only reason why I'm not infected, because God has spared me. And he said, don't try to change me now. He said, because many women have. I said, but he says, this wasn't my thing. CDC and its partners are pursuing a high-impact prevention approach to advance the goals of the National HIV AIDS strategy to minimize the effectiveness of current HIV prevention methods and improve surveillance among older Americans. Many activities to get them tested, support and technical assistance. CDC has a webpage that's just designed for the elderly where they can go on and get these facts and learn how to protect themselves. Many of them are learning how to use the computers in senior centers, and they may not have that discussion with us yet, but they want to go read on it on their own. That's more for my younger patients, so I actually applaud that. ACT Against AIDS, a national communications initiative that focuses on raising the awareness, fighting the stigma, this is a big thing here, and reducing the risk of HIV infection among at-risk populations. You know, people say, I don't like that term at-risk because I won't say a large percent, many of the patients I treat are not in that at-risk population. They didn't do drugs, they weren't promiscuous, they weren't intravenous drug users, they didn't have more than one sexual partner, they never had an STD. So that's why I always say know your HIV status, because many people who become positive are very shocked that they're even positive. I did everything right. As one woman with 3 children, I was just a wife. She said to me, she's no longer with me now. You know, she finds out at her husband's, well, he was part of the mob, I can say that, but he was shot for other reasons, but it was another woman who came to the funeral to let her know that she was infected, and her husband passed it on to her. Okay, and by the time we tested her, she was full blown. Her children are now in college, her brother took them over, but at the time when I took care of her, and you have to be with these patients, it is doom and gloom because she had very advanced disease. And she said, what did I do to deserve this? I was someone's wife. I'm someone's mother. So, let's fight this together. We can prevent HIV and AIDS. It's one of the most preventable diseases. We may not have a cure, but we can prevent it. All I'm asking you to do is use a hat, know your testing, know your status, and get into treatment. People can live a long time. A lot of my patients don't progress like the 80s and early 1990s or even 2000. Many of them are on a 1 pill a day. When we talk about 1 pill a day in terms of a regimen, it has 3 medications in it to keep the virus suppressed. Our goal is to get the virus's non-detectable levels. Remember I said there were 10 million copies in a 24-hour period? When we consider someone less infectious is when their virus, that viral load is less than 20 copies per ml of blood. But that's not a guarantee that you can't pass on infection. It's less likely you will. But again, I'm not here to discuss people's practices, but I know they exist. What men with men do, some women do what men who have sex with men do, and that is a higher risk of transmission of the virus. So we have to be careful. So with the medication today, less than 20 copies doesn't mean that they don't have the virus. It's just suppressed, and they're on 1 pill a day. So you hear the term adherence. We have evidence-based interventions. ACT AIDS is a national communications initiative that focuses on raising awareness, fighting the stigma, reducing the risk of HIV transmission among at-risk population, I don't like that term, but education to physicians and addressing complex issues of those dealing with HIV and AIDS. The care and prevention in the United States demonstration projects has suppressed increased testing and optimized linkage to care and prevention and engagement with care prevention services for newly diagnosed racial and ethnic minorities with HIV. That's what Tanya does out of our office at Garden State Infectious Disease. So anyone, if they wanted to walk off the street and get an HIV test, they could. If a doctor's office didn't feel comfortable, because believe it or not, I still get providers who say, I don't have anyone in my practice, to say that's because you haven't tested anyone in your practice. There's something called community viral load. We know how much virus is in our South Jersey community. We know from a state level, as well as a local level, how many people are suppressed on the virus. If the community viral load is like community blood sugar, if all of us were diabetics in this room and our fasting blood sugar wasn't between 99 and 110, I would say we have a problem, because the goal is to get it under that so that diabetes doesn't spread. That's the same thing with HIV. So when we talk about HIV, we talk about the community infected with HIV. We have a community that's infected, and our goal is to bring them under non-detectable levels, and then we can less likely worry about risk of transmission. Our goal is to not have new infection rates. We have not met those goals yet. But the population, as our society lives longer, people are having sex, no matter how they're having it, whether they're elderly, they're moving on, remember that's 50 and over in the HIV community. So it's not just the young thing, it's our thing as well. And we have to be positive about prevention. So it's a lot, resources go into prevention of HIV.